Imaging plays a critical role in how brain tumors are diagnosed, treated, and monitored over time. The two most commonly used imaging tools are CT scans and MRI scans. CT scans use X-rays to create quick images of the brain. They're often used in emergency situations, such as when someone comes to the hospital with sudden symptoms or during surgical planning. CT scans are fast and helpful for initial assessments. MRI scans, on the other hand, use magnetic fields and radio waves without radiation to create very detailed images of the brain. Because MRI is safer and provides better soft tissue detail, it's used much more frequently throughout a brain tumor patient's care, from diagnosis to follow-up. The frequency of imaging depends on how aggressive the tumor is. Faster growing tumors need closer monitoring, while slower growing ones may be scanned less often. When doctors review brain scans, they look for several key features, such as irregular tumor edges, areas of dead tissue in the center, swelling around the tumor, and how the tumor lights up after contrast dye is given. These clues help indicate how aggressive the tumor may be and guide treatment decisions. Advanced MRI techniques add even more insight. Some scans assess blood flow within the tumor, others analyze how water moves through brain tissue, and some look at the tumor's chemical makeup. Together, these tools help doctors understand whether a tumor is growing, stable, or responding to treatment. However, imaging alone cannot provide a final diagnosis. A biopsy or surgical sample is needed to examine the tumor under a microscope and perform molecular testing. These results, combined with imaging, are essential for determining tumor type, treatment options, and prognosis. Regular MRI scans are also key for follow-up, helping doctors detect recurrence or treatment effects. When scan results are unclear, a multidisciplinary team of specialists often reviews the case together to decide next steps. Clear communication between patients and care teams is essential throughout this process. When you're trying to understand a diagnosis, having clear, trustworthy information matters. We've made free resources available to help you explore your options and make sense of what comes next. You can find them at wetrials.com.